All right. Hey, folks, this is Lauren Lucchini, CEO and co founder of RPMt. I am here with Ives Soto, our Director of Provider Relations for Coordination Centric. Thank you.
Yeah, so as you mentioned, I'm the Director of Provider Relations for Coordination Centric. We are a technology company in the healthcare space. When you consider the pandemic and COVID just in general, what it does to the geriatric population, right? It was literally killing our elderly patients with chronic conditions, right? And before the vaccines came out. So going to a doctor's office was prohibitive, right?
Right.
Because the last thing you want to do is go see a bunch of healthcare workers that might have COVID-19. They don't have chronic conditions, but you do, right? And it's a risk for you to go to the doctor's office. So what I saw out in the field was a lot of doctors were no longer seeing patients in the clinic.
Yeah.
But how do you jump from a face-to-face type of service to a telepresence or telemedicine or telephonic type of service, right? We had to adapt very quickly because we've been, pounding away at this for years already, right? And going back to what you talked about, Medicare was nice enough to adapt quickly. They were not quick to adopt this because we had been talking to healthcare legislators for years. Texas is one state that was forward thinking in how they saw remote patient monitoring services and telemedicine services. They're very progressive in that way. Now, the rest of the nation and CMS really didn't follow suit to that. But when the pandemic hit, they're like, okay, well, these guys have been talking to us for years, right? Trying to get us to do telemedicine and telepresence and trying to be able to get paid for it. Let's finally give in, right? So I think for the most part, the acceptance, right, is there because of the pandemic, and we've had a great windfall because of it in terms of our service offering. However, there's still a lot to be done. It's still very new in doctors' offices in a lot of ways, right? Unfortunately, right? We can't get to everybody, but I think there needs to be a lot of training that goes on with doctors. I think there needs to be a lot of training or education that's happening with the legislators as well, right? But that's a whole nother subject, not to get into politics.
Yeah, I like your perspective though, and thanks for sharing that because you're right. My perspective was, oh no, the pandemic happened and CMS comes out with this waiver and you're like, no, I've been fighting this fight for years. I've been, I've been wanting to get this. This is not quick. Then maybe quick for you because you just knew it, and just discovered this, but it's definitely not been a quick process for CMS to adapt. So I appreciate that. You saying that is how RPM works within the home health world. I wanted to ask you, where have you seen this be the most successful?
I would have to say, if I had to pinpoint an answer, right, I think most home health agencies see a real benefit to their number of avoidable hospitalizations. Out of every 100 patients, let's say 45 of them are avoidable. But the thing is that home health, like I mentioned, you're going once, twice, maybe 3 times a week. You're not going every day. So what happens the day when you don't go, right? Patient may end up in the hospital, and then you end up with your 21% hospitalization average like the rest of the US, right? Or, the state that you're in.
That's definitely, that's great. So it's keeping folks out of the hospital. It's keeping your staff also able to get a little bit more attention to your patients without having to utilize your staff's physical body in their home, right? So you're cutting down on travel time. So that's great. But you said something earlier that I wrote down because I thought, oh, this is like a good nugget to focus on the revenue, not just the cost savings, right? So how has remote patient monitoring grown revenue for home health.
The thing is that with remote patient monitoring, it's like I said, it's still fairly new. So a lot of people don't know the revenue stream. They don't understand how that works. Now in a home health, you'd be fortunate if you're getting like right now, probably like 8-10% on your money, where in remote patient monitoring, you're going to get at least 30%, right? So those are great returns in healthcare. So from a revenue perspective, it makes sense to implement it. Now, going back to some of the agencies that I know that started in home health, they've gone completely remote patient monitoring.
Oh,
So
wow.
they've stopped their home health services in favor of remote patient monitoring, because in a lot of ways you may be getting 8-10%, but then you have recoupments. Now, Lauren, let me interrupt you a little bit. In no way am I saying stop doing home health. By the way,
Oh, no, that's what I heard you say.
Yeah, no. Don't stop doing home health. It's a great service. We need it. We obviously need it for our chronically ill patients. I think now more than ever, right? The challenging part of that is, like you said, it's heavily regulated. Not to say that remote patient monitoring isn't heavily regulated, but home health in general has not been represented as well as a hospital, or as well as the physicians out there, as well as other big associations, right? Home health doesn't have that. So when when regulators want to save money, they go after the guys that don't have the loudest voice, right?
Right.
So it's been a challenge for home health, and I have a lot of respect for home health owners, right, and for what they've been able to do through the pandemic. They are part of our healthcare worker heroes out there, right? So all props to them, and
Yes.
like I said, keep doing what you're doing, but you can do it better.
Yeah, I think I appreciate you saying that, and that was good. I'm glad you made sure. We love home health agencies, right? What would we do without home health? We are the nurses, the teams, the administrators, directors of nursing, PTs, OTs. In home is just a blessing to so many people. What we're saying is RPM is an amazing addition to your home health service, as well as it can help with revenue streams. Thank you so much for joining me in this discussion about remote patient monitoring with RPMt. Please reach out to us. Our information is below. We are excited to help you start your own remote patient monitoring program.